Hello, good day, good morning, good afternoon to everyone who have joined the webinar today. Welcome to MedExam Expert. This side, I'm Anam from Team MedExam Expert. Today, we are going to host a webinar for MRCEM, Emergency Medicine, along with our prestigious mentor, Dr. Neeraja from India. So this webinar will be hosted on the two main agendas that would be the knowledge sharing for MRCEM exam and also about introduction to how we are going to help students to prepare for this exam. So it's an honor to have all of you here today in this webinar with us. So if any student would have alongside any query, they can just raise the hand or they can just type in the chat box. We will give them chance one by one to clear all the doubts about MRCEM exam, and they will be guided properly by their mentor. So over to Dr. Neeraja. Welcome to webinar, Dr. Neeraja, and here's your stage to just discuss about MRCEM. Good luck.
Okay, thank you. Thank you so much for your warm welcome. So I think all are there for the webinar today. So our topic can be divided into two. Before that, good afternoon to everyone. I will give a small introduction about myself. My name is Dr. Neeraja. I have completed MRCM and I have GMC registration. So I will be joining as a senior clinical fellow in one of the prestigious NHS trust by the end of this month or on the first week of September. Before that, am I audible to all of you? Am I audible?
Yes, Dr.
Yes.
Neeraja, you are very much audible.
Yes.
Okay, so that's the short introduction about myself. I can help you with the further proceedings, like how to find a job in UK after completing this MRCOM OSCE, how to find a job, how to complete the GMC registration. So what are the further proceedings? So I can help with that too. So in our today's webinar, I will be dividing these sessions into two. First one is a small introduction or small detailing about the MRCOM exam and the second session will be regarding how the course will be like. So moving to the first session. Okay. So I will request all of you to please pay attention for the first section. For the first section will be for 30 minutes. In between, if you have any doubts, please scribble it, and I will give you 5 to 10 minutes at the end of the first session to ask questions. So what is this MRCOM exam? This MRCOM exam consists of three parts, that is MRCOM Primary, MRCOM SBA and MRCOM OSCE, and this exam is conducted by the prestigious institution, that is Royal College of Emergency Medicine. So usually they will conduct 2 exams per year. Our exam is on October 29th. So in this exam, they will assess the skills and knowledge in line with RCM curriculum. So why I stress this RCM curriculum is that they have a defined curriculum for all the exam. So they will ask question from this curriculum only. So no need for reading all the stuff. You will not get any benefit by reading all the things. You have to strictly adhere to this curriculum. Then you can you can score well after this exam. So this MRCM is just a postgraduate membership exam or a diploma exam only. So after completing the OSCE and after completing the OET, you will get this membership only by exam, not by training. You have to complete training to complete all the thing. So you can add this post-nominal MRCM only after attaining a membership with the RCM. And the next thing is after you getting the GMC registration, that is completing all the 3 parts and membership exam and OET, you will get the GMC registration. Then you can apply for training there. You can apply for CSER pathway or CCT pathway. And usually all of us prefer to join as non-training initially. Then we will move to the training portion after making our portfolio strong. And you can complete the full CCT or CSER from the UK, and you can work as a consultant in UK as well as overseas. So the MRCOM exams consist of 3 parts. First one is MRCOM Primary. In MRCOM Primary, they will test the preclinical subjects like anatomy, physiology, microbiology, biochemistry, pathology, and some evidence-based medicine, that is our community medicine. MRCOM SBA is purely our emergency core medicine, core emergency medicine. That is, they will test our knowledge in emergency. That is according to Oxford book. And Finally, the MRCEM OSCE, that is purely a practical aspect. They will check your knowledge through practical. There will be 18 stations, and each stations you will have a question. You have to you have to diagnose the case. You have to tell them the management plan. That is the MRCEM OSCE. So this is purely this exam. They are checking our knowledge and skills, whether we are able to provide a standard quality to the patients in the emergency medicine. They are checking this much only. And next thing, uh, regarding our exam. So this is our MRCEM exam is purely adherent to the 2021 RCM curriculum. You can refer there. This curriculum is there in the RCM site. You can refer that what the curriculum says. And next thing is, yeah, I have some notes with me. That's why I'm looking here. And next thing is, I think all of you have applied for the MRCEM exam. After 2 to 3 weeks, you will get an email from the RCM for booking a slot. This is a computer-based exam, so you have to book a slot through Pearson VUE. And you can prefer either morning or afternoon session. You have to enter the exam with passport, your identification, identity card, like passport or anything else you want. And you will provide one pen and one paper for doing calculations. If you want, you are not able to enter the hall with any books or any pen from your side. That's all about that thing. Next thing is the pass percentage. Comparing to the three parts, the pass percentage for the MRCEM primary is high, because this is the easiest exam comparing to the other two parts, because you can score very high mark in MRCEM primary exam. Usually the cutoff is between 95 to 110. I think last exam the cutoff is 107. And the least cutoff which I have seen is 97. So we can expect a cutoff in between 95 to 110. That is regarding cutoff, and the pass percentage is very high for this primary exam. And next thing is, as I have already said, after completing all the three parts, you will get the post-nominal degree MRCEM. Also, we will have a convocation from the RCM. That is the interesting fact. So regarding the exam, so this is just a theoretical exam, computer-based theoretical exam. This is a 3-hour exam. You will have multiple choice questions. You will have 5 options for every questions, and total 180 questions. So 3-hour exam means 180 questions with 180 minutes. So you can calculate that is 1 minute for one question. That is the most dreadful thing, because you have only 1 minute for one question, and you have to be thorough with all the topics. And the single best answer question is the pattern. Usually they have 30 to 50% will be direct question, like what is this, what is that. We can expect that type of questions. But recently the pattern is changed. You can expect long stem questions as well as application level questions. So these application level questions will be mostly from anatomy and physiology. That they will say, I can tell you one thing, that is ulnar nerve, medial nerve, radial nerve. They will tell that a patient came with all these complaints and patient is not able to flex the hand or flex the elbow. So what you're expecting, like radial nerve injury or medial nerve injury, at what level? This is a sure shot question from anatomy. So they might ask this application level questions. Usually for the last 2 exam, they are more interested in this application level question. But 30 to 50% will be 50% of the questions will be direct question. Then regarding the marking pattern, they will award 1 mark for correct answer and 0 for incorrect answer. Yes. Yes, please.
Sorry.
Yeah, you can mute yourself. I will give you 5 to 10 minutes for any clarification after this first session. So you can ask your doubts there. Okay. Is that okay for you? Okay.
Sending him, because Unisa, inshallah. Okay, it will be good. And
Okay.
Unisa,
Yes.
Unisa and that Bangladeshi cleaner, no, they are making problem. Maybe something push that cleaner. Someone.
Okay. So you will awarded 1 mark for your correct answer and 0 for incorrect answer. There is no negative mark. So I will suggest you to attend all the questions. Even if it is wrong or correct, we don't have any problem. If it's correct, you will get 1 more mark. If it's wrong, since there is no negative marks, you have to attend 180 questions fully. That is the first suggestion I have to give you. The next thing is, yes. So this is the first step towards achieving your prestigious training from the NHS Trust, that is CSER or CCT in emergency medicine. And another interesting factor is, if you are interested, you can take dual CCT, that is CCT in emergency as well as CCT in critical care, because in critical care there is 3 pathway. You can enter the critical care through emergency, through anesthesia, through general medicine. So you can take dual CCT also after completing the MRCEM and GMC registration and joining the training post. And your exam is on October 29th, 2024. As I have already said, there will be 5 choices for each questions, and you have to mark the best correct answer. And that is the changes in recent exam. So the last exam, usually we are predicting that there will be 10 questions from evidence-based medicine. But the last exam, there are more than 15 questions from evidence-based medicine. So in each exam, they are making some changes, and now they are more concentrating in long-term questions as well as application level question. So what you have to do that, not just mugging up all the theory portions will not help you for attaining good marks. You have to understand the basic theory behind each topic. Then you can apply that theory to the question and you can score good marks. So the next thing is, I will be taking the class according to RCM curriculum only, because I can tell you the RCM curriculum about one topic. I can tell you that. So that is posterior compartment of forearm. In the posterior compartment of forearm, RCM curriculum said that you have to study the muscles and movements of brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, supinator, abductor pollicis longus, extensor pollicis longus, and extensor indicis. They have mentioned that you are supposed to know the actions and innervations only. So no need of studying all other unnecessary things about these muscles. The first thing is, you may not be able to remember all those things in your exam, since this is a volatile subject. The second thing is, there is no benefit of studying all these things. So my class will be strictly based on the curriculum only. Then regarding the number of questions we can expect for the exam. From the anatomy, you can expect 60 questions. That is from upper limb, lower limb, thorax, abdomen, head and neck, central nervous system, and cranial lesion. So from these all topics, you can expect 60 questions out of 180 questions from the anatomy part. From the physiology part, you can expect 60 questions. That is from basic cellular physiology, respiratory physiology, cardiovascular physiology, gastrointestinal physiology, renal physiology, endocrine physiology. From these all parts, you can expect 60 questions. So out of 180, 120 questions will be from anatomy and physiology. So I think you have understood the importance of studying anatomy and physiology. Even if you are not able to revise or study another topic, if you are thorough with anatomy and physiology, you can score at least 110 marks out of 180. So you have covered the cutoff marks for clearing this exam. So anatomy and physiology is the most important subjects in this exam. Regarding pharmacology, you can expect 24 questions. That is from gastrointestinal, basics of pharmacology, cardiovascular, resp, CNS, infections, endocrine, fluid and electrolytes, musculoskeletal system, immunological products, vaccines, anesthesia. These are the topics coming under pharmacology. In the class, I will stress which are the topics you have to give more importance to. That will explain in the class. And from microbiology, you can expect 17 questions. That is from principles of microbiology, pathogens groups, and principles of microbiology. Only 70 questions will be from microbiology. Next, from pathology, you can expect 9 questions. That is from immune responses, infection, wound healing, and hematology. And from evidence-based medicine, you can expect 10 questions. But for the last exam, I think they have asked more than 15 questions from this evidence-based medicine. So that includes statistics, study methodology, principles of critical appraisal. We have studied all these things during our UG days in community medicine. So these are the topics you should cover for the exam. This total of 180 questions will be asked. So pathology and physiology, you have pay more more time for studying anatomy and physiology. And next thing is about exam. Like this is a computer based testing exam conducted in English. You are supposed to participate in the exam in Pearson View centers. So you have to select the centers. I think within 2 weeks you will get the mail for applying for the slot. And as I have already said, you have to remember a lot of anatomy and physiology, and you should be able to apply reasoning to the questions. You can expect long stem question. You should be thorough with the basics. Then only you can appear for the exam in a well manner. Next thing is, I will tell you one thing before this. One of the most important question which is asked in I think 3 or 4 times before in the past questions is dermatome of umbilicus. So dermatome of umbilicus is T10. So you will study that dermatome of umbilicus is T10, but the exam time you may not be able to remember is it T10 or T4. You might have options like T4, T6, T8, T10 and T12. So at that time, if you have any confusion regarding is it T8 or T10, but you have some idea, I think that is T10. So you have to do one thing is that just mark T10 and flag the question for review. Why? Because usually you will have 1 minute for one question. So if you are not attending that question and moving to the second question, at last, if you didn't get any time for reviewing the questions, you may not be able to attend that question. So I will suggest all of you that even if you are not sure about one question, just mark the option which you thinks the most suitable one. So you in this example, you are thinking that T10 may be the answer. So you do one thing, just mark T10 and flag the question for review. At last, definitely you will get some time. At that time, you just review the question and think, is it T10 or T8? And you can mark the correct answer. That is the first thing to how to attend the exam. Next thing is, you can flag the questions as well. So you utilize that thing too. So next thing, the questions will be like this. We can expect 50% of questions in this manner, that is direct questions. See this, in the question given is superficial external ring lies. There are 5 options: superior to pubic tubercle, inferior to pubic tubercle, medial to pubic tubercle, lateral to pubic tubercle, midpoint of pubic tubercle. So you know something is related to pubic tubercle. Is it superior? Is it inferior? Is it medial? So if you have any confusion, that's why I am mentioning this question here. So while studying the topic, you have to be thorough with that. Is it superior or inferior? Because at the exam day, you might have confusion. Is it superior or inferior? So before that, study in such a manner that this is superior, superficial, yes. So superficial external ring, yes, stands for yes. So superficial external ring is superior to the pubic tubercle. So study with some clues like that. And the next thing is, what is the importance of reading explanations of the questions? See, in this thing, we have two deep, this topic is from inguinal region. So in inguinal region, there are 2 rings, that is deep internal, deep ring and superficial ring. What's the benefit is that we can expect 3 questions from here. First question is the superficial ring, that is superior to the pubic tubercle, as I have mentioned. The second thing is you can also expect another question. Where is the deep ring seen? That is, it's seen above the midpoint of inguinal ligament. Next question you can expect is this deep ring is formed by which muscle? So this is formed by transversalis fascia. Next thing is the superficial ring is formed by which muscle? This is formed by the evagination of external oblique. So see, you can expect 4 questions from this topic itself. That is the importance of reading explanation. There is no benefit of doing questions and just mugging up all those things. You will not get any benefit for the exam. You can expect 30 questions from the explanation itself. So while doing questions, please pay attention that just read the explanation part also. So in my classes, I will be giving classes and I will be giving note like this only. So from this chart itself, you can complete all the boundaries of inguinal canal. So you can classify as superior wall, anterior wall, posterior wall, lower wall. So you can remember as two muscles, two aponeurosis, two teeth, and two ligaments. So I will be taking classes in such a manner so that you can easily remember. And the next thing is you can just go through the notes one day prior to the exam, so you can remember all those things. So just I am giving a short like how I will take the classes for these sections. So I think I have completed all the details regarding the exam. So if you have any doubt, you can ask now regarding the exam pattern. Do you have any doubts?
Hello, dear students. So, one by one, you can just raise your hand, and we are getting, I guess, the queries, Dr. Neeraja. Then you can start replying to students. So, you can turn on the mic. Yes, please. Zoom user, you can start. Hello there, Zoom user. Whoever you are, we are not aware of your name, and we cannot hear you if you are turning on your mic. So, please check it.
Uh, Hello, doctors.
Yeah, you
My
are
query
audible
is that,
now.
yes, sorry for inconvenience. Dr. Neeraj, my question is that you haven't mentioned the upper limb in the anatomy portion. Is it included in the exam or not included? Upper
Sorry,
limb
I can't
in
hear you
anatomy.
properly.
I'm asking that you haven't mentioned the upper limb subject or upper limb
Yeah.
portion in the anatomy. The text you have
Yes.
shown to us isn't mentioning the upper limb. Is it misprinted or not included in the exam?
No, in the anatomy, you can expect upper limb, lower limb, thorax, abdomen, head and neck, central nervous system, and cranial nerve lesions. These are the topics coming under anatomy.
Yes. But the text, the slide you have shown to us doesn't include that portion of upper limb. The upper limb was not written in that. That's why I'm asking.
Upper limb is there. Actually, just right to the anatomy, upper limb is there. Upper limb is also included. Don't
Okay.
worry. I will take
My
all
bad.
the sessions for you. Don't worry about that. Take upper
Okay.
limb, lower limb, thorax, abdomen. Yeah, I will
Okay.
explain how the classes will be like on the next coming slides.
Okay. Thank
Any
you.
other doubts?
We have a query in a chat box, and it says that kindly mention eligibility for all parts of MRCEM exam.
Okay. Eligibility means what you want to say. Can you clear the question so that I can? One second. I can see the chat box.
Yeah, Dr. Neeraja, you can use the chat box.
Just 1 second. What about pelvis perineum anatomy? I will take that too in the abdomen part, pelvis perineum. So, histology and embryology. No, we are not expecting histology and embryology in an exam. There is less chance of getting histology and embryology. Eligibility for parts of MRCOM. So after even completing like your house surgency, you can appear for MRCOM primary. For attending MRCOM intermediate, you must have at least 6 months of experience in emergency medicine. And for attending OSCE, you must have 2 years of complete experience in which at least 6 months should be in emergency medicine, if I'm not wrong. Any other doubts?
Yes, there is another query. Can one not practicing currently attempt the exam?
Sorry. Can you please tell me how to do precisely microbiology? Precisely microbiology means you can expect more questions from basics of microbiology. From the basic pathogen part, you can expect maximum 4 or 5 questions, not much. And in that too, you can expect some questions from like herpes and other virus. I will explain all these things during the exam. Can one not practicing currently attempt the exam? Yes, you can attempt for MRCEM primary, but for MRCEM intermediate, you must have at least 6 months experience in emergency. You can attempt MRCEM primary. Even one who complete MR like house urgency or internship can attend for MRCEM primary. Any other doubts? Okay, ma'am, can you please tell me how to, past papers? Yes, that's the thing. I will explain about this in primary. You can expect at least 40% from past papers. Another benefit for you, those who are appearing in the October session is that you can expect 20 to 30% direct questions from the previous MRCEM primary exam. Because usually in MRCEM exam, we can expect previous year questions. So I will tell you about all these things in the coming slides. Is it eligible to sit exam if current employment is polyclinic and past experience? Yes, you can, but no emergency medicine. You can appear for this thing like MRCEM primary. You can directly appear for, but for MRCEM intermediate, I think you must have 6 months of experience. Anesthesia resident, I don't think so. With anesthesia experience, you may not be able to appear for MRCEM intermediate, I think, because you must have at least 6 months of experience in emergency. When will the results of MRCEM primary come? After your exam, in the RCM side, you can check when will the exam results will be publishing. They will mention the result date in the RCM site, examination site. They will be mentioning the exact date of announcing the MRCEM primary results. You can check there. Any other doubts? Any other doubts? Can I move forward? Yes, okay, thank you. Best source for studying for primary. Yes, this is the best source. You can follow our course and you can practice our questions. You can appear for our mock exam. You can like follow our notes. So that's all. Any other doubts? Yes. So I forgot to tell one thing. During exam, you have to read the question carefully. Why? Because there is some loophole in the questions. You may fall into that. So you must read the each and every word of the question carefully. Because sometimes the question might be which of the following is not applicable or which of the following is applicable. So you have to read the question carefully whether it is not or whether it is applicable. So that's another important advice from my side for all of you. Regarding our course, so in this session, I will explain how to study for the exam, how the course will be like. So totally we are expected to have 15 sessions for our courses, and each sessions will be from 2 to 3 hours sessions. We will start the first session on August 15th, and our last session will be on October 15th. So within 2 months span, we will complete all the portions. And next thing is I can give you how the course will be like. On the first session, we are taking upper lip and lower lip. And the second session, we are taking thorax, abdomen. And the third session, we will be taking rest of the abdomen, head and neck. Fourth session will be on CNS and cranial nerve lesions. So by the end of August, we will complete anatomy portions. And the next thing, in the September 5th session will be on principles of microbiology. Sixth session will be on specific pathogen part 1. Next session on specific pathogen part 2. and next session pathology, ninth session rest of the pathology and evidence-based medicine, 10th session basic physiology and respiratory physiology, 11th session cardiophysiology, gastrophysiology, renal physiology. So by the end of September, we will complete this much topics. And from October 4th to 15th, we have 4 sessions. That is 12, 13, 14, 15 session. From on 12th session, we will take class on endocrine, biochemistry, endocrine physiology and essentials regarding some biochemistry topics. And 13th session, you can expect a pharmac topics, that is basics of pharmac, GIT and CNS. 14th session will be on regarding cardiac and respiratory pathology, respiratory like pharmacology, and last session on the rest of pharmac. So the 15th session will be on October 15th, and we will complete all the topics on October 15th. That's our plan for this course. And regarding our classes, we will be having 2 classes per week, mostly on Tuesday and Friday. This time, that is 2 p.m. Indian time, and I don't know about other time in other countries. So according to 2 p.m. Indian time, this time will be the perfect time for our classes. We will be having 2 classes per week. And if there is any change in time or any change in class, I will be inform you in prior. Yeah, moving to the next thing. Yes. So how can you score well for the exam? So what I have suggested you that, suppose if I am taking the first session on Tuesday regarding the anatomy, I will tell you that so our first session will be on upper limb and lower limb on Tuesday. What you have to do is, you have to, after paying close attention to our class, you just read the notes once more on that day itself. And on Wednesday, you do upper limb questions from our site. You can practice the questions from upper limb, but remember, you have not only just doing the question, read the explanation as well. That's a very important part. On the next day, that is on Thursday, you do the lower limb questions. So you have completed upper limb and lower limb on that coming 2 days. Our next section will be on Friday. On Friday, I will be explaining about thorax and abdomen. So Saturday, you do all the questions from thorax, and Sunday you do all the questions from abdomen. So you have completed half portions of the anatomy in the first week itself. So what you have to do before the next session, that is on Tuesday, you have one more day, that is Monday. On Monday, you have to revise all these topics, that is upper limb, lower limb, thorax and abdomen. So you have completed all the topics and just small 2 revisions for these topics. This much is more than enough for that week. So again, continue the same process in the coming weeks. After 2 weeks, again do a small revision about all the topics covered in the past 2 weeks. Because revision is the success mantra for this exam. Without revision, you may not be able to clear this exam, because all the topics are much more volatile and you have to be thorough in all the topics. Then only you can give the answer in a short span of time. So time management can be somewhat controlled by this method. So revision is the most important thing for clearing this exam. And I will be providing notes through slides while I'm taking sessions. So you have to solve the questions after each session. Next thing is, in the site we have some extra notes too. I will be taking classes according to the RCM curriculum. I will not take any other unnecessary topics for the classes. I will strictly follow the RCM curriculum. If you want to do anything extra, you can follow this from the site. There are notes in the site regarding all the topics. Next, there will be 2 mock exams in our site. So I will suggest you to attend this mock exam after October 15, because without reading or studying all these topics, attending mock exam may not be helpful for you. So attend mock exam after October 15. After October 15, you will get 2 weeks time. So I will give you a small idea how to revise this topic. So I have already told that weekly revision is important, and 2 weekly revision you can do. The next thing is, after October 15th, you can do the next revision for, I think there are 13 days before the exam. So you can take the next revision for the coming 10 days. for within the October 15 to October 25th, do the first grant revision. That is, divide the days for every subject and do the revision. And the first week after the October 15, do the first mock exam, and the second mock exam on the coming second week. So you have completed 2 mock exam. You have do the grand revision in the coming 10 days. So you have 3 more days before the exam. So what you have to do is do one more revision. That will be your last revision. That is 3 days prior to the exam, do the next revision. This will help you. Actually, this is the way I followed for the 3 MRCEM exams. That's why this will work for you too. And what you can do next is, sorry. Another one thing is golden book. Actually, while studying, I have one book with me. So what I do was, after taking the classes or after reading the books, I just scribble down the things which I think I may not be able to remember this during the exam. So I have to read this on the morning day of the exam. So I just scribble down all these things in a small book, not full notes, but just small things like radial nerve, like dermatomes, like what to say, some pharmacology things. And I just scribble down all these things which I think is volatile for me. So you can also scribble down all these things in a small book. What you have to do is, you have already completed one 10-day grand revision and second revision for 3 days. On the day of exam in the morning time or just the night before the exam, just read this golden book only. No need of reading anything else. Just read this golden book. I assure you this will work for you too, because I followed this for my all the exams and it worked well for my primary as well as intermediate. But for OSCE, definitely you need some practical skills. So that's another important thing. And the time management, I have already tell you 1 minute is there for one question. So how you can tackle this is, you can mark at least 30 to 50% of question just after reading the question. That will be direct question. If you are thorough with the notes, you can just mark the correct answer just after reading the exam. So you have saved at least 30 to 45 seconds there. So you can use this time for the later time. So what I have told you tell you is that use this time management in your mock exam. So strictly adhere to this time management during the mock exam so that you can appear well during the live exam. Next thing is flag question. Flag questions can be used for practicing time as well as on the day of exam. While you are doing the practicing questions at the time, you just flag the question which you are supposed to read once more. So the second week of revision, you can just read that flagged questions once more. So you will get a clear-cut idea. So yes, I am having some doubt regarding what the insertion, what's the origin of this muscle. So you just flag that thing. We may not be able to remember all those things from the first reading. So just flag that thing. And the second time revision, you just read that flagged questions. So that will be helpful for you. And another thing is, we have a group for all queries and discussions. And what I am supposed to do is, because our sessions will be for 2 or 3 hours. So for upper limb and lower limb, initial 1.5 hour will be taking for upper limb, and the rest 1.5 hour will be taking for lower limb. If you have any doubt, you can ask your doubt in our session after the class. Because in between, if you are asking the questions, I may not be able to complete the portion in this short span of time. So I suggest you to ask all the queries in the group. I am here to help you. I will give all the answers for your queries just after the class, or even not only after the class, any day you can ask your queries, or if you want any discussion, you can ask in the group. And if you are not able to follow one thing, if you are not able to follow the anterior thigh muscles, what you have to do is, you please mention in the group that, ma'am, I can't understand that topics. Could you please tell me once more? So what I can do is that on the next session, I will just give a brief idea again about that topic on the next session before moving to that day's topic. Okay, that is regarding your queries and discussion. Next thing is previous year questions. Another important thing, important mantra for clearing this exam, you must read all the previous year questions, at least six previous year questions. You can expect almost 30 to 40% of questions from previous year question. And for this exam October session, you can expect at least 20, 30 or 40 questions from the previous like May exam, primary exam. You can expect that much question. So you must read previous year questions. That is very important. And you must know how to apply your basic theory for the questions. So this last 2 weeks for revision, I have already said you must attend 2 mock exams and just scribble down all those things you want in your golden book. Just follow the golden book on the day of the exam, and 2 days, no, the day just before the exam, you just read your golden book. And the last 2 days, you must revise. Quick revision is needed. You quickly revise all the topics in the last 2 days. And what I suggest is you have to strictly adhere to our courses, because 2 months is more than enough for clearing this MRCEM primary, because MRCEM primary is the easiest part in the MRCEM. You can score more than 130 marks if you strictly adhere to course, if you are strictly adhere to our timetable. And the next thing is you must practice questions. Not only reading all the theory won't help you in time management and won't help you in clearing this exam. You must practice questions. After thoroughly like study all the basic theory, you must practice the questions in the coming 2 session, flag the questions, again do the doubtful questions, and last 2 weeks again do the revision, like refer the previous year questions. And that is the only thing you can do for clearing this exam. So I can assure you 100% that if you strictly adhere to our course timetable and strictly adhere to doing questions and doing previous year question, surely you can get more than 130 marks in your MRCEM primary exam. So if you have any doubts, you can ask now. And if I miss, I will tell you now.
Okay, Dr. Neeraja, there are a few queries, but since you have ended with, let us just share some news with the students who have joined today. So I'll be sharing a screen and giving some news to the students as well for the course, and then we can answer. There are a few queries remaining in this chat box, right? So I'll just be quickly announcing about the course, then you can move towards the queries part.
Yes.
Thank you. So first of all, thanks to all of the participants once again from the team Med Exam Expert, from Dr. Neeraja and all the team. So about the course that Dr. Neeraja have mentioned, we are going to start from 15th of August with the basic for first class, and you have got the details about it. So course is structured such that we have this live Zoom classes. We will give you the recordings of those classes for the later revision. For example, the student who will miss out the sessions, they will be given the recordings for those. Then we have primary notes as well for the exam. You can have the quick flashcards or notes for the exam as well. We have a question bank there with the updated 3,500 and plus questions to practice. As Dr. Neeraja mentioned, that question practice is the basic thing which will help you understand how to timely manage and answer the loopholes of the questions. Then we have a Telegramic based study group. This is the study group that you will be following after the live classes and even before that for any sort of the queries that you have regarding MRCEM primary or any topic related to MRCEM primary exam, so that you can get the grip on the topic and we will be moving forward to every next topic after that. Then we have a mock exam. So let us tell you that this mock exam will be a real-time exam, like a real exam, and it will be computer based, and you will have a proper time counter in that, and you will have to practice exam under pressure, that how it feels like a real exam to answer all the questions within the given time. And also, there is a good news for all the attendees, that people who have joined us today, we are very glad it was our first session. And those students who want to enroll in the course, they will be given 20 USD off on our course. It is very first time, so we welcome you all. And definitely it is going to be a very good course, because we and our mentor, Dr. Neeraja, we are putting a lot of efforts in it. So we expect you all to join and just get started. For the registration number is given on your screen. We have the website, we have developed system, we have a proper LMS that is based and designed such that you can easily use it on your mobile phone as well. You can study anytime and practice questions and get the notes on your mobile phone as well through our app as well. So if you want to enroll the course, we will be sharing these steps, easy steps through our WhatsApp as well. If you want to have a contact, our team member will just drop in their contact in the chat box right now, and you can just contact them from there. So this is the schedule that we have already created, and Dr. Neeraja have beautifully explained that how she's going to divide the topics daily and how we are going to help the student understand the basic topics from you can say upper limb till the pharmacy. We are going to do all, and we are going to cover all. We are putting in efforts for our dearest students, so you're all welcome to join. If you have any query, we will put our number in the chat box right now, and you will just have to contact us. Our team will guide you properly. You will be given proper help how to join, how to enroll. Then even about exam related queries, if you have any exam booking queries, we will be available to help you all. So this is all about it. Thank you so much, everyone. We are so glad, and you were very good audience, and it was a very great session. Now over to you, Dr. Neeraja. There were few unanswered queries, so you can just attend to them. Thank you so much, everyone.
Yes. Yeah, I forgot to mention one thing. That's what's the important of like referring the previous year questions is that apart from getting the direct questions, you will get an idea about what are the topics they are usually asking questions. Yeah, this is the thing, because the now part, media now, radial now, all these parts are in all the exam you can expect 3 or 4 questions. So while referring the previous year questions, you will get an idea which are the topics you have to give stress for revision time. So that's another thing which I forgot to mention. So we can conclude that the success mantra for this exam is revision, revision, revision. Nothing other than the revision. Next thing is referring the previous year questions. Next thing is, if possible, this golden book, because you can revise all the things which is more volatile to you on the day of the exam. This works for me very well. That's why I told you. You can do that also, and thus you can score more than 130 marks in the primary exam. I hope all of you can pass the exam with good marks, and it's very easy to pass this MRCEM primary, even MRCEM intermediate and MRCEM OSCE is somewhat difficult, but to clear MRCEM primary is like very easy, because the pass percentage is very high, so you can clear this exam easily. And next thing is this 2 months. 2 months is more than enough to clear this primary exam, because it's very easy exam, not that much easy. You have to study, then it's very easy. So I can answer your queries. If I miss something, please mention me, okay? So, yes. One second. Yes. Are we eligible to work after completing MRCEM primary and OET? No, you are not eligible. For getting GMC registration, you are supposed to clear your MRCEM OSCE as well. There is some other like pathway like MIT, but I am not sure about all those things. It's better to complete all the 3 parts and OET, get the GMC registration, apply for non-training jobs there, get a non-training job, create your portfolio, then apply for your training post, and complete your training in emergency. I think it might went for about 5.5 years. So complete your training, get the CCT or CSER which you want, then you can be as a consultant. You can work as a consultant either in UK or in like overseas. You are not able to work after completing MRCEM primary and OET. This is not possible. Next question. Please explain Ankoff method of checking. Actually, Ankoff method, for my intermediate exam, they have applied Ankoff method, but I don't know how to clearly explain about this thing, because they check how many students clearly answer that questions. So if they have found that one question is very hard, they just check how many participants clearly correctly answer that questions. Then they must apply something. Actually, I don't know much clear about Ankoff method. I didn't search for that thing. If you want, I just read it and will definitely tell you in the group. I don't know much about that Ankoff thing because I didn't go through that. And don't worry about Ankoff thing. You just pay attention to the topics. You just read that. Even studying anatomy and physiology, you can score about 90 to 110 mark. That much is enough for clearing the exam. No need of thinking about Ankoff method at this time. Okay. So next thing is, what you say that the best residency or job during MRCM preparation and clearing all parts. Best job is working as a medical officer in the emergency medicine, because for this primary exam, you can study these preclinical subjects, anatomy, physiology, and all those things. Just need some study. You have to give some time for studying all these preclinical subjects. But for MRCM intermediate, you must have some clinical knowledge in emergency medicine, because they are testing the core emergency things for this MRCM intermediate exam. Even if mug up some theory part, you may not be able to attend all the questions. You must have at least some knowledge regarding the emergency practical aspect. And for OSCE, definitely you must need an emergency experience, because the thing is, there are 18 stations. 2 stations will be rest stations, and you have 1 minute for reading the question and 8 minutes for appearing for the exam. Suppose the questions will be like a 40 or 50-year-old men came with complaints of pain in the genital region. So pain and swelling in the genital region. Question will be there. Take the history and find the diagnosis and and give the instructions or the treatment for the patient. So you must know how to approach the patient, how to be how to approach the patient while taking the history. You know what are the questions we are expected to do, because we have only 8 minutes for doing all these things. And next thing is, you know what must be the differential diagnosis. It can be torsion, it can be epidermolysis. So you must have some idea regarding what can be the differential diagnosis in this clinical scenario. And you must know what's the treatment portion for treatment plan for this. Even if it is torsion or epidermolysis, what is the treatment plan? So for this, you may not be able to clearly explain all those things within 8 minutes if you not have any good clinical experience. So I will suggest you to work in the emergency department. And the next thing is communication skills. They are giving at least 20 or 30% for your communication skills. So even if you're communicating well to your patients during the working hours, you will be clearly pass this OSCE within that 8 minutes. You can clearly communicate the patient. Like how you are working in the department, you are doing the same thing. The only matter is you are getting only 8 minutes for all these things. That is the one of the most pressurized exam in my life. That is the MRCEM OSCE exam. So you must have some experience in emergency. So better to start work as a medical officer in emergency department. Is 3 months enough for exam preparation? No need of 3 months. Even 2 months is more than enough for clearing this exam. But the thing is, you have to give more attention to study all the things, revise the things, doing the previous year questions, solving the questions. If you are strictly adhering to all those things, you can clear the exam in this 2 months period. That's why I am frequently telling you that I assure you that if you are strictly following to our plan, you can definitely clear the exam with more than 130 marks. I will assure you that. Yeah. Any doubts? Kindly share your experience related to residency or job you did or doing while you cleared all parts of MRCEM, how you managed both. Okay. So after completing my MBBS, I started working as a resident medical officer in critical care medicine. So I get some knowledge about how the critical care is moving, right? From that time onwards, I have more than 46 months of experience in emergency medicine. Currently, I'm working as a post which is equivalent to registrar post. So, in our emergency department, we have more than 50 bed with resource areas, major areas, minor areas, and clinical decision units. We are taking care of the patient by ourselves. We have consultant too, but we are taking care of the patient by ourselves. So, from there, I get the idea how to take decision for treatment plans, how to approach a case. So this experience helped me a lot. And for MRCEM primary exam, I attended for the MRCEM primary exam, I think after 8 or 9 months after my internship. So for that, no need of any experience is not mandatory. You can attend the exam with just studying all the theory part. For MRCEM intermediate, you must have some experience in emergency. And job you did residency or job, I did in emergency medicine, and I just take 15 days or 2 weeks leave just before the exam for preparation. But in between, I started my preparation about 2 months back. Before the exam, I just read all the things, and last 2 weeks I just take for revising the things. And this golden book, I have this golden book for all the three parts, and I just quickly read all the things in my golden book on the day of the exam. So that's the thing. Yes. How you managed both means, actually I worked in the emergency department during my preparation time. In OSCE time, definitely you must work, because if you are not working at that time, you might lose the connection in the emergency. So you may not be able to communicate well with the patient. You may not be able to give the differential diagnosis within a short span of time. So I will suggest you to continue work and in between study the parts. Yeah. Can we directly apply directly after house job? For this MRCEM primary, you can directly apply. How much time it took to clear all parts? Kindly mention individually. Primary, intermediate, or OSCE. Time, mention like to clear all parts. For primary, you can clear the exam within 2 months of preparation, but for intermediate, you need some more time, because at least 3 to 5 months, because intermediate is the vast, intermediate topic is very vast, and that is one of the hardest exam among the three parts. So you might give some more time for clearing intermediate exam. Regarding OSCE, even with practice, and if you have some knowledge in practical emergency, you can clear OSCE. And intermediate, the pass percentage is very low for intermediate comparing to primary and OSCE. You can clear primary in 2 months, but for intermediate, you need 3 to 5 months. And for OSCE, definitely you can pass the OSCE in 2 months. Is it enough just to, okay, 1 second. One more question before that. From where we can get the previous year questions? I think there are some Telegram groups available. In that Telegram groups, we have previous year questions PDF. And we will try our best to incorporate these previous year questions in our mock exam. If possible, I will take a sessions regarding this previous year questions, but not sure. If time permits and if possible, I will take a session on this previous year questions. Otherwise, you can check in Telegram groups. In Telegram groups, these PDF questions are available. Otherwise, we will incorporate this in your mock exams. Is it enough just to pass the MRCEM primary exam, or percentage of marks? No, nothing like that. You just have to clear the cutoff. Usually the cutoff will be between 95 to 110. You just if you are getting even 111, if the cutoff is 107, even you get 108 or 130, both are same, because you have to just cross the cutoff. That matters. Percentage or nothing like that. There is no future aggregate also. You just have to clear the cutoff mark. That's only needed. Calculation based questions come in exam. Sorry. Yes, we can expect some calculation based question, but I don't think that may be like a huge calculation. Simple calculation we can expect in evidence based part. But you can do it with the help of the pen and paper provided. No need of calculator. That much calculation may not be asked. but you can expect at least maximum 1 or 2 questions for simple calculation in sensitivity, specificity that area. There may be questions. Yes, there are questions for calculation. You can expect that questions. Yes, next. Hi, doctor. I applied the primary exam with no experience in emergency medicine. Yes, you can apply for this primary without emergency medicine experience. If I provide emergency medicine experience and I book intermediate exam, thank you. Yes, that is necessary. Because you can appear for the MRCEM primary exam without emergency medicine, but before appearing for the MRCEM intermediate, you must have emergency medicine experience. Can I appear in MRCEM primary without GMC? See, you get GMC registration after clearing MRCEM, OSCE and OET. Another way of getting GMC registration is clearing the PLAB 1 and PLAB 2. So you can apply for MRCEM primary without GMC. Okay, thank you, Dr. Sumaila Malik. Hello, doctor. I am from Pakistan, but I have done my MBBS from China. Can I give MRCEM exam without having my home country license? Actually, I'm not very sure about that. I think you have to submit your registration for application. I'm not sure about that. I just checked that and I will tell you in the group. I'm not sure about that, but I think you have to submit your registration, any of the medical council registration while applying for the exam. Even if it's from China or from the home country, you must have a medical council registration. That is mandatory. Without registration, you can't apply for this MRCEM primary. Who is the author name for Golden Book? See, what I have mentioned was Golden Book is that is not a book. You just scribbled out the things which you think you have to read on the day or on the day prior to exam. That is the name which I given to that book is Golden Book. There is no book like that. You can just scribble down the things you have to. Yeah, you think that I have to read this topic on the day of the exam. You just scribble them points you have to. You may have to read on that day. That's the thing. There is no book like that or Golden Book or informative. Thank you, Nayab. How to register for the course? Please help. Yes. Thank you, Mustafa. Thank you, Anam. Thank you, Abdullah. What's the expiry of all parts like OET is 3 years? OET expiry is only 2 years, not 3 years. And MRCEM primary, there is nothing like expiry, but if they are planning for any change, they will inform you in prior 24 months before they are changing the pattern. So there is nothing expiry like that. How many sessions are we going to do in the course? There are 15 sessions. The first session will be on August 15th or 16th, and the last session will be on October 15th. So there will be total of 15 sessions. Hi, doctor, is OET is needed? No, OET is not needed for MRCEM primary exam. You need OET after MRCEM OSCE for GMC registration. No need of OET for primary exam. Any other doubts? I think I have cleared all your doubts. So we can stop here. Any other doubts? Yes, thank you. Thank you so much. Which academy you choose for OSCE exam in UK? Actually, I applied for my OSCE from Chennai. So some of our friends, we just create a group and we practiced ourselves for OSCE. That. Okay. Let me stop this. Any other doubts?
Yes. I guess that we have pretty much answered all the doubts. So it was a great session. Thank you so much, participants, again, and Dr. Neeraja. Everything was covered very beautifully, and yeah, we understood about the basics of MRCEM and all the details. So for any further queries, we have shared the free WhatsApp guide group link as well, and then we have shared the course counselor number as well. If you want to reach out to Dr. Neeraja, you can also drop in the message in our group or to the number directly. We will be helping you on that. And if you have any query, you can always reach us to Med Exam Expert. We have our official Facebook page as well. So we are available on all mediums like WhatsApp, Telegram, and Facebook. So it's easy to reach us, and we'll be hoping to see all of the students who have joined today in the course as well, to get the extensive access to the schedule as well, and to study along properly under guidance of your mentor, Dr. Neeraja. So thank you so much for the session today, Dr. Neeraja. Thank you, everyone. We will be terminating the meeting now. Thank you, everyone.
Yeah,
Goodbye.
thank you so much. Thank you so much, all of you, for your valuable time. Thank you. Thank you so much.